Hello, I'm Dr. Walter from SNS College of Physiotherapy. So today we are going to see another lecture video regarding the nutritional anemia. Anemia we have already know that is low in blood level. What is nutritional anemia? So this thing which is most important in our community area, and this also comes under the subject community medicine. Okay, so we all know anemia. Okay, so you might have learned in your second year regarding the general medicine regarding this anemia topic, yes, and also in the first year in your physiology while you are learning the topic blood. Now we are going to see what is this anemia, what is nutritional anemia, and how it is affecting the community people. Now we are entering into the definition: insufficient healthy red blood cell. So that is the proper definition for the nutritional anemia. What is RBC? What is insufficient healthy RBC? In a human body, we are having, all of them are having RBCs. So what is the number, what is the quantity matters here. So all the matters, how much quantity should be a quality ones. More the quantity, less quality should be not happening in a human body. Normal quantity, normal quality should be other in this normal blood cells. So healthy red blood cells are most important for each and every human being. Now this insufficient healthy red blood cell will induce reduced oxygen delivery. So you know blood carries the oxygenated content. So as we have learnt in our cardiac cycle, this oxygenated blood will be carried over, deoxygenated blood will be removed through the process of the cardiac cycle. Yes, we have seen all these things. Now, reduced oxygen delivery will be carried over through, in our India, it is widespread. Yes, sir. In our class also, among 100 students, we can see more of the people, more of the students will be having this anemic problem, and more of you will be aware of this and will be having your rich food contents. So who and all will be getting caught in this nutritional anemia? Most common, women and children. Okay, so women and children need to be very careful about this anemic problem. So what and all things which is happening inside, we are going to see inside, that is iron, folic, and the vitamin B12 deficiency. All these three things plays a major role in the deficiency of the RBC. So iron deficiency, vitamin B12 deficiency, and the folic acid deficiency can be improved through any type of food contents. As we all know, during our childhood days, our parents would have given more of nuts, that is dates. We can also add up in the nuts category, the almonds, and all the things, cashew nuts, and all these nuts will be helpful in the enriching of the iron and the B12 categories. And most of the meat categories will enrich this RBC content in our human body. So if we are less in content, that is less in taking the food content, we need to be careful in taking the proper rich food content. Now, signs and symptoms: fatigueness. Most common thing is fatigueness. So women and children, more commonly they will be, if they are affected with nutritional anemia, they will encounter with fatigueness. So tired, less tired, more tired. They will categorize and they will say. So proper, like if they are driving a vehicle, after driving a vehicle they will go for fatigueness. Or if they are climbing up a stairs, they will go for fatigueness. If they are speaking for more than 10 minutes, they will go for fatigueness. These are most advanced cases. Normal cases, if they are sitting inside the class itself, they will go for fatigueness. So these are things which are happening in the fatigueness. Pale nail. So if we touch our nail and see, we can able to see the rich blood content. So if this area, while doing like this, if we can see this area is not going for redness, it is pale nail, whitish color. Headache and dizziness. So these things will be encountering along with the fatigueness. Now going for the supplements. As we know, all these things are happening in our human body. We need to have some supplements. What are the supplements? Iron folic acid tablets, or encountering with foods, that is staple foods which is good in rich rice, rich wheat and salt content. Why it is called as rich rice and rich wheat? All the food contents are rich, but we need to be ensured which is good for our health, and we need to take Anganwadi centers. And children can use this Anganwadi centers in your nearby areas, and this Anganwadi will be promoting a proper diet meal which will be rich enough to hold the less of anemic content. Hope you might have understood this nutritional anemia, and from upcoming class we'll see in the next video. Thank you.